No. Well, good morning, everybody. Welcome to the Prevention Community of Practice, Syndemics and Substance Misuse Prevention. This is the third part in our Syndemic series. And if you were with us last time, welcome back. And if you're here for the first time, we're going to do a lot of recap for you. So don't worry, you'll be able to catch up and join in the meeting that we have planned for you today. We do, and I'm going to ask Mana. Mana, can you just watch that admit button? Make sure nobody's waiting out in that waiting room. We get everybody in the meeting. That would be very helpful. Okay, terrific. Again, welcome folks. This is a recorded meeting, and so we do ask folks to mute your microphones just for the large group portion. We will be going into a lot of small group discussions today. So you won't be able to multitask during this meeting very easily. We've got a lot of large group instruction combined with small group time. So we're going to give you an opportunity to get right into small groups this morning and meet each other. We will take you through this very interactive agenda that we have planned today. So before we dive in, I'm going to have actually Jill Burke with the Bureau of Substance Abuse Prevention. If you'll just welcome folks and let them know what today's meeting's all about.
Yes, good morning, everyone, and welcome to our community of practice, where we're going to really dive in deeper to syndemics and the use of data. This is the third in a series of community of practice sessions. Exploring how syndemic science and systems thinking can enhance our health outcomes in New Hampshire. As we learned in the first community of practice, syndemics refers to linked health issues, which are not simply co-occurring, but are mutually reinforcing, meaning that the burden of disease they create is much greater than the sum of the problems created by each individual issue. Simply down, there are two pillars of syndemic science. The first is epidemiology, and the second is system approaches with an emphasis on multi-sector coordination. During our last meeting, we explored epidemiology using the YRBS from Carroll County as an example. Today, we will continue our use of Carroll County's YRBS data to explore the second pillar of multi-section coordination. And we thank Carroll County Public Health Coalition for allowing us to use their data for this community of practice. And from there, we are going to go into a series of breakout sessions. And so I'm really looking forward to and I welcome everyone. And with that, I will turn it back over to Mary Ellen.
Terrific. Thanks, Jill. Okay, so right off the bat, we're going to go ahead and have you meet your small group members that you'll be working with a lot during today's session. So in these small groups, we want you to go ahead and just introduce yourselves to each other. And we'd like for you to each name at least one partner that you are thankful for and briefly explain why. So that's a work-related partner that you have that you've been working with, and just talk about why you're thankful for them. Very easy. We're going to spend just 5 minutes in this small group. And so we will send you into your groups automatically. Give us just a minute to be able to run those logistics for you. Be patient with us as we get you into your groups, and then we will see you back here and give you your instruction for our next part of the meeting. So Mana, if you can put folks into their small groups, and scribes, you can get ready.
Than it was supposed to.
5 minutes.
Oh,
5 minutes for that group. So I think we gave folks 5 minutes.
okay.
I think it said 10 minutes on the agenda. I think that's why
It did, yes.
I was confused as well too, but
Oh, okay. Sorry about that, folks. Sorry, did folks, do you need a little bit more time in your small groups, or did folks get at least a few surprises and no surprises
Yeah, we're good.
generated?
Yeah, I think we're okay. We didn't,
Okay.
everybody didn't have a chance to respond though, but I think we got the gist.
Oh, okay. Well, we'll spend a little bit more time in large group report out. And if folks have things that they want to add that you didn't get out in your small group, apologize for that. We do have a lot of breakout groups today, so we'll be going in and out of them rather quickly. So let's go ahead and if I can start out with group number 1, if you just report out if there's any surprises, key surprises. And then as each group reports out, we'll just note where the commonalities are. We don't need to duplicate any surprises that are already up on the board. So group 1, what did you note were surprises or not really surprising?
Sure. So one of the biggest surprise, but not a surprise, was the not going to school and seeing the correlation to smoking. I think seeing it intuitively makes sense, but seeing it was a surprise. What was not a surprise, we had a lot of school-based people that noted that stress clearly is the underlying cause for many of those risk factors that we saw there, and that students with a history of trauma in their lives, many of them, violence is a reaction that they carry out as well. So seeing that, and then one of the other things was really kind of that, again, that correlation between mental health, substance misuse, and trauma, as I mentioned before. And then lastly, a comment on what the data is not showing us, which we'll get into later, wondering about when you see some of those risk factors, such as getting to fights in schools, does the school have restorative justice policies that enhance well-being? So that was group 1.
Wonderful. Group 1 members, did anybody have anything they wanted to add to that you didn't get a chance to say in your small group time? And just go ahead and unmute yourselves. Okay. All right, and feel free to use the chat as well. Okay, group 2, how about you? Somebody from group 2 report out?
So there were not a lot of surprises. People noted that they knew of many of these relationships before, such as healthy eating, physical activity, that national research, supports these relationships. People were surprised about how that you could actually pull this data out of YRBS, that that we could actually mine YRBS to look at the odds ratios, what's the likelihood of different things being linked or correlated. And there was also a comment about how stressful it is to go to school for some kids, and how that stress leads to unhealthy behavior. So there's a bit of discussion about that, and just that people talked about this reminds us why prevention is so important and how one thing can impact another, and realizing that people working on different issues have shared outcomes and linkages was really important. Someone else said that the demographic breakdown wasn't surprising for the geographic area that's being used as an example, and think it would look different in other parts of the state.
Mm-hmm. Great. Okay. Anybody else from group 2 that didn't get a chance to report out that wants to add anything? Okay. Terrific. Okay, let's go on to group 3.
Okay, thank you, Mary Ellen. This is Jeff, and I guess the first comment that we had was there was a surprise, smoking less if they did not go to school. I believe Peter mentioned that, but on the same token, he also thought that that was not a surprise because of some of the work that he did. And the smoking less if not going to school was mentioned a couple of times. Some other things that were of no surprise were trying to lose weight and the relationship with self-harm. It wasn't a surprise that folks that ate breakfast smoked less and got better grades. And we did have one question: does the YRBS have any questions on eating disorders?
Oh,
And I didn't know the answer to that.
okay. We'll go ahead and note that one as a question.
I think
Okay.
the questions that try to get at the eating disorder are whether you've skipped meals or take diet pills. I don't think there's one that says, have you ever been diagnosed with an eating disorder? But I think they're trying to get at that by asking the students the type of behavior that's indicative of that.
Thank you, Regina. Okay. Anybody, any additional comments from group 3 that you had a surprise or a not surprise, but you weren't able to get it out during your small group time? Okay. All right. How about group 4? Any new surprises or no surprises that aren't already up on the board for you?
I think the only one we had that hasn't been mentioned before as a surprise was that there was no correlation between living with a person with depression and smoking. And Jess, if I didn't get that right, can you just chime in?
No, you got it right.
Okay. The other thing too, maybe for the next section, is that I think the feedback we got was it's when people can see me scribing, it's not as helpful. They really need to be able to see the bigger diagram to look at it again as we sort of filter through this stuff. So if that's a possibility, I don't know if other groups felt that way, but we could just keep it on your screen, Mary Ellen or Lori.
The larger, that's a good thought, Regina. And as we go into our next small group, what might be helpful is to share the picture and the information that the group needs to see in your small group, and then just scribe on Post-it notes around that frame.
Oh, okay.
That might be a little bit more helpful.
Okay.
Terrific.
And
Thanks.
then we'll just drag them to the report out after. Okay.
Any other comments? Any other new surprises or no surprises that aren't up here yet that folks want to make sure we make note of? Okay. All right. So now we're going to be heading into our next activity. And we have a mission assignment for folks setting up this next small group. So Lori, I'll turn things back over to you.
Sure. And I don't know if it's just me, Mary Ellen. I'm just seeing black screen. I'm not seeing your screen. There you go. Okay. So we have, as you saw, we've been mining YRBS data to try to understand why are these conditions linking and why are they moving together. We identified the conditions first, and then we were able to isolate some variables that were correlated. So where we're going where we're going with all of this is to begin thinking about what partners we would need to recruit or strengthen or partner with. Who would we need to partner with to address these different variables that may be in areas that your daily work doesn't cover? But before we go there, we want to see what else we can learn about these students. and these different behaviors. And so each group has been assigned a variable that impacts more than one condition. So people are going to, one group is going to be looking at fasting, one group is going to be looking at sexual intercourse with 4 or more people, one group will be looking at a physical fight at school, and one group is going to be looking at eating breakfast. And your mission is to figure out what, if anything, can you find out from YRBS data about these students? Are they mostly males? Are they mostly females? Is there not a lot of difference? Are there certain grades where these behaviors are highest or lowest? So we're going to be looking at prevalence. How common is it among males or females? But we'll also be looking at incidence. So are there certain ages where the behavior is growing faster than other ages? Or are there certain grades where the behavior increases most dramatically? It's all about giving us an idea of who are the students most impacted by the variable assigned to your group? What can we learn about them? And are there certain ages or grades where the problem's growing very quickly, which helps us know when we need to intervene, at what point in time, what age or grade. And so YRBS, every question is reported out 3 ways. One is for all students, one is for males only, one is for females only. So in your small group, you've got access to the 3 data sheets for the question, the variable you'll be working on in the question. But to make this a little bit easier, we've also created a table for each group that summarizes those responses, so that instead of having to look across the 3 different pages, you can look at the summary table to kind of tease out what's going on. So you're going to be wanting to look at those things, male versus female, or doesn't it matter? Where is it most common, and where is it growing or decreasing most quickly? So with that.
Okay. And I see there's some comments in the chat too that are great comments and observations. I think all of these factors are related to youth's sense of not having control over issues in their lives. They need to feel empowered. All really great comments. So go ahead and continue to use that chat to share your perspective and information. Okay. All right. So this time in your small groups, you will have 10 minutes, I promise. And we really want you to focus on your variable. Like Lori said, each group is assigned a different variable. So this is an opportunity to look at the data and dig in a little bit deeper. Any questions from folks before we go into this small group activity? Okay. All right. So Mana, we're ready for our 4 small groups. And scribes, get ready to share your screens.